In my first video on disability and mental health, I explained that although many people who come to me for a disability exam tell me they're mentally ill or have been told that they're mentally ill, I think that the majority of them are mentally normal people who are having to deal with a lot of stress and are sometimes overwhelmed. I certainly do see some people who are clearly mentally ill, but the majority are not. In this second video, I'm going to talk about what constitutes mental illness and the types of mental illness. Then, in the third video in this series, I'll talk about things that you can do to help your mental health and when seeking professional help may be a good idea. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done over 1,500. And as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, as I said, I think it's a popular misconception that if you're not happy and cheerful all the time in any circumstance, you're mentally ill. And I think that's nonsense. All of the manifestations of mental illness are sometimes seen in normal people. Let me give you an example. At the death and funeral of a parent, one would expect you to be extremely sad and even despondent. At the birth of your first child, a normal person would be overwhelmed with joy and ebullient. That's normal. A person who was overwhelmed with joy and ebullient at the funeral of a parent, or a person who was overwhelmed with sorrow and despondency at the birth of their child, might have a serious mental illness. It all depends on the circumstances. We all at times have manifestations of all mental illnesses: extreme worry, extreme sadness, extreme happiness, even giddiness, and even hallucinations. We tend to think that only crazy people have hallucinations, see things or hear things that aren't real. But we all hear things and see things that aren't real. We do it when we're asleep and call that dreaming. People with schizophrenia see things and hear things and believe things that aren't real while they're awake. It's like dreaming while they're awake. We also all experience moments of confusion and forgetfulness. Most people who are experiencing disability and going through the Social Security disability application process are under extreme stress. The stressors include the simple fact of being sick or injured, unpleasant treatments such as surgery or medication with unpleasant side effects, uncertainty about the prognosis, what's going to happen in the future. Will the person get better? Will they get worse? How much better? How much worse? How long will it take? Many of the people that I see are experiencing chronic pain, and chronic pain by itself causes sadness and the symptoms of depression. There's the stress of losing one's health care insurance and then being sick or injured and being unable to get the care that we need. The loss of the ability to work can cause a loss of self-esteem and self-worth. We often feel that we are our job. When I am a doctor, for example, we may lose structure, the routine of getting up in the morning, getting ready for work, going to our job, doing our job, and then returning in the evening. Lack of money can be a severe stressor. Bills have to be paid. Family members may need money. Health insurance has to be paid. There's co-pays for doctors and hospital treatment. Some people are even facing bankruptcy or homelessness. Many folks are having loss of mobility. They may need an assistive device like a cane or a walker. They may lose their ability to drive or the ability to use public transportation. Relationships can be strained. One may lose their role in the family as being the caretaker or provider. One may become socially isolated, unable to see other people or participate in family events. Dependency can be a problem, the need to rely on others for things that one used to be able to do oneself. I've even had cases where the partner left the disabled person because they didn't want to take care of an invalid. Finally, there are often feelings of guilt. People often feel like they played a part in getting sick or getting injured. And if you're finding these videos helpful, you might want to subscribe. I generally put out one video a week on disability topics. Now I'm going to talk about next the indications of mental illness, when a person may actually be mentally ill instead of a normal person dealing with stress. The first is recurrent hallucinations. Hallucinations are experiencing things through the senses that aren't real. It can be seeing things that aren't real, hearing things that aren't real, feeling things that aren't real, or even smelling things that aren't real. Recurrent hallucinations generally indicate a serious mental illness that requires psychiatric care. The next indication is severe depression that does not lift, that does not get better, especially if it involves thoughts of suicide or inability to perform what we call activities of daily living, taking care of oneself, bathing, dressing, shopping, eating, etc. Next is the compulsive use of alcohol or drugs. I think the best definition of addiction is continued use despite harm. Another indication is serious persistent eating problems, either overeating and gaining weight or undereating and losing weight when these are not due to physical issues. Serious persistent problems with sleep, either insomnia, the inability to sleep, or hypersomnia, where a person sleeps most of the night and most of the day. Another indication is inability to care for oneself. That involves bathing, taking care of the teeth, eating a reasonable diet, exercising, and socializing, interacting with one's family, relatives, and other people. Feeling persistently overwhelmed or stuck, like there's something bad that has happened and you just can't get past it no matter what you do. And finally, the observations of others. Sometimes mentally ill people are unaware that they're having a problem, but others can see it clearly and bring it to their attention. Now I'm going to talk about the different categories of mental illness. And again, this reflects my opinions. By current thinking, my opinions are somewhat heterodox and archaic. The first category is the neuroses. People with neuroses are in touch with reality, with rare exceptions if the neurosis becomes extremely severe, such as extremely depressed people can become out of touch with reality, and we call that psychotic depression. An example is a patient that I saw when I was a medical student who was a nun who was so depressed she believed that she was possessed by the devil and had to commit suicide. People with neuroses feel bad, usually anxiety or depression or some combination of both, and they have what therapists call insight. They realize that they have a problem, that the bad feelings they have are coming from inside of them, and that if they were able to change somehow, they would feel better and things would get better. The second category is what we call the psychoses. The hallmark of psychoses is that the person is out of touch with reality. They have some combination of hallucinations, usually hearing voices that aren't real, delusions, which are beliefs that aren't real. For example, I have talked about the patient I had with schizophrenia who believed that people were plotting to kill him at all times and heard voices of people plotting to kill him. People who have psychosis may or may not realize they have a problem. They may or may not have insight. For reasons that we don't really understand, most of them feel bad, and their hallucinations are bad, and their delusions are bad. Again, such as the person who felt that people were plotting to kill him and heard voices plotting to kill him. Occasionally, the hallucinations and delusions can be good, and that's usually a manifestation of extreme mania. The third category is what we call organic brain syndrome, and a commenter on my first video had a good observation that physical problems can produce psychiatric manifestations and are sometimes overlooked. Remember, the brain is an organ in the body, and problems with the brain or problems with the body can produce abnormal behavior and abnormal emotions. When it comes to the brain, things can include a brain infection. I mentioned a person who was admitted to the psychiatric ward who was thought to be psychotic and having an episode of schizophrenia, who actually had neurosyphilis, a bacterial infection of their brain. Can be brain inflammation, can be brain degeneration, as in Alzheimer's disease, or a brain tumor, which can be benign or malignant. Also, head injuries, brain injuries, can cause abnormal behavior and feelings. When it comes to the overall body, there's many conditions that can cause abnormal feelings and behavior. The first is poisons, and we've all seen this because alcohol is a brain poison. Many drugs are brain poisons, and there are a host of other brain poisons that can produce psychiatric manifestations, such as heavy metals, lead, and mercury. There are problems with the electrolytes, the salts in the blood. Very high or very low salt in the blood can produce psychiatric symptoms, as can very high or very low calcium. Also, very low oxygen or very high carbon monoxide can produce brain symptoms. Hormone issues can cause brain symptoms. A classic one is overactive thyroid hormone, which will produce anxiety, or underactive thyroid hormone, which will produce depression. One of the hallmarks of organic brain syndrome is that the hallucinations tend to be visual, An example is a patient I saw when I was a medical trainee was a man who was experiencing alcohol withdrawal and saw a little green dinosaur in the corner of his room. They're rarely auditory. People with organic brain syndrome rarely hear voices. Also, tactile hallucinations and olfactory hallucinations, feeling things that aren't real or smelling things that aren't real, are almost always due to physical problems. Another characteristic of organic brain syndrome is that the symptoms and manifestations may wax and wane in the same day or even over hours. That's quite rare in psychiatric disease. People with organic brain syndrome are often confused. They're not with the picture. And they may or may not realize they have a problem. Generally, it depends on how confused they are or are not. The fourth category are personality disorders, and they're somewhat unique. First of all, they begin the earliest in life, sometimes even before the first year of life. They're generally manifested by childhood, before puberty. And in personality disorders, the people completely lack insight. They think they are fine. They think that all of their problems are due to other people. And if the whole world would just change its behavior and act the way it should, the person with the personality disorder would be just fine. The final group are the addictions, and note that it's common to have either a neurosis, psychosis, organic brain syndrome, or personality disorder, plus an addiction. As I mentioned, the best definition I've seen of addiction is continued use despite harm, and there's a good 4-question method of determining whether a person is likely to have an addiction called the CAGE questionnaire, C-A-G-E. C stands for, has the person ever felt the need to cut down? A, have they ever been annoyed by criticism of their behavior? G, have they ever felt guilty? And E, have they ever felt the need for an eye opener, which in alcoholics is the need to have a drink when they wake up in the morning to prevent the shakes. In my next video, I'm going to talk about things you can do to help your mental health and cope with the disability process, and when you might need to seek professional help. And as always, remember, if it happens, it's possible.